Any heat-generating sources, such as direct heat, radiation, chemicals, or friction can result in a burn. There are different types of burns based on the depth of burns and surface area affected by the burns. Let's first study the main concepts of rules of nines. We can use the rule of nines to find the size of burn area. This method divides the body's surface area into percentages. The front and back of the head and neck equal 9% of the body's surface area. The front and back of each arm and hand equal 9% of the body's surface area. The chest equals 9% and the stomach equals 9% of the body's surface area. The upper back equals 9% and the lower back equals 9% of the body's surface area. The front and back of each leg and foot equal 18% of the body's surface area. The general area equals 1% of the body's surface area. On the basis of burn depth, we can classify the burns into following types. First, we have superficial thickness, burns in which there is burn of only epidermis and patient feels tingling sensation and intense pain. Basically, this type of burn heals itself. Next, there is superficial partial thickness burns. The burn can affect the dermis area, and there could be edema causing reduced blood supply. Usually, in this type of burn too, no skin graft is needed after healing, although we can apply grafts for early healing. In deep partial thickness burns, the skin is red on the surface and white on deep areas. There is no blister formation and there is moderate edema, and skin grafting may be necessary. Grafts may be required. In full thickness burns, there is no skin sensation as nerves are damaged. There is waxy white-yellow colorish skin. The entire dermis and epidermis is destroyed. Grafts are required and also skin grafting may be necessary in this type of burn. In deep full thickness burns, the area is blackish with total lack of sensation due to damage of nerves. The effect of the burns reaches internal bones, muscles, and tissues in this type of burn.